What's up, guys? Welcome back to Patho and Chill. Today, we're going to be talking about kidney disease, most specifically nephrotic syndrome, which has a key difference to another disease we're going to be talking about in the next video, which is known as nephritic syndrome. And basically, the main difference is what causes it. So before we get started, roll the intro. Okay, guys, so like I said, in this video, we're going to be talking about nephrotic syndrome. And so like I mentioned, there was a key difference between that and nephritic syndrome. And the key difference for nephrotic syndrome is that it is not caused by inflammation. So nephrotic syndrome is known for 5 key criteria. The first one being massive proteinuria. So we're going to be discussing more the pathophysiology of it, but basically there is an increase in the secretion of protein from the blood to your urine, and as you guys may or may not know, we are not supposed to have any protein in our urine. So number 2 is hypoalbuminemia. And so once again, because we're losing a lot of proteins and they're being filtered from the blood to the urine, one of these proteins is albumin. And so once it's being filtered, we are losing albumin in our blood, thus the hypo for albumin. The third one would be generalized edema. So like I said, once again, whenever we get to the pathophysiology of it, we're going to discuss why we're getting generalized edema. And so 4 and 5 have to do with lipids. The first one being hyperlipidemia, so an increased number of lipids in the blood. And then the second one is lipiduria, which would be an increased concentration of lipids, but in the urine this time. Okay, so as I've been mentioning before, we're going to talk about the pathophysiology. So what exactly is happening? So guys, you have your capillary lining, right? And so next to your capillary lining, you have basically your tubular, the tubules of the kidney, where you basically secrete and return and reabsorb electrolytes and water. So in that membrane where there's filtration occurring, you have 3 layers, right? You have your endothelial layer, which lines the blood vessels, and then in between that you have your basement membrane, and then right next to that, as you're moving from the blood vessel to the lumen of the tubules, you have your podocytes. And so what is basically happening is that there's damage to this capillary wall, right? And so when the damage occurs, it's basically going to allow an increased permeability from the blood to the tubules. And so what's going to happen because of that? Well, because now there's a greater space because of the damage, so now proteins are going to have a larger space to actually filter into the tubules of the kidney, and so we're going to have proteinuria. So remember when I was talking about the five key criteria, one of them was hypoalbuminemia. So that's because the albumin is going from the blood into the tubules. So we're losing the albumin, so hypo. So once again, to reiterate, because we have proteinuria, so protein in the urine, we now have a decrease in protein in the serum, the blood. Okay, so let's make that clear. And so because we're losing protein in the blood, we're basically losing colloid pressure. And so the more protein that is in the blood vessels, in the blood, that's basically going to attract more water. So that's in normal cases, right? But due to this loss of protein in the blood, so now water is not being attracted into our blood. And so thus we're going to be losing blood volume. And because this water isn't going into the blood vessels anymore, it's accumulating in the interstitial space within our body. And so this is what leads to that generalized edema that I was talking about, which was key point number 3 in the nephrotic syndrome criteria. But the problems don't stop there. So now, because we have a decreased volume in the blood vessels, we have a lower pressure to basically filter whenever the blood vessels reach the kidneys. Since there's not as much volume in there, they don't have as much pressure to filter all these electrolytes and various drugs or whatever you want to call. So there's a decreased GFR glomerular filtration rate. God dang. And then whenever there's a decreased GFR, so the body starts responding to it. And so how does it respond? It increases ADH, so antidiuretic hormone, basically antidiuretic, so we don't want to pee. So by not wanting to pee, we're going to reabsorb water. and that is going to be further on assisted by the increase in renin secretions. And if you guys remember, the renin-angiotensin-aldosterone system, basically increased renin is going to increase aldosterone. And so what does aldosterone do? It increases the reabsorption of sodium and water back into the blood, which makes complete sense, right? So this is how the body basically starts to cope with this decreased blood volume due to the decreased proteins and basically osmotic pressure. However, like I already mentioned before, we were starting to get edema because there was an increased volume in the interstitial spaces rather than the blood. But with all of this sodium reabsorption and water reabsorption from aldosterone, well, this is also increasing the edema. So it's kind of like this ongoing cycle. And so basically the main signs of the whole renal disease and nephrotic syndrome is generalized edema. So now you guys can understand a little more why this happens. And so now there are three main complications that we should watch out for. So I know I've been drilling into your brain how we're going to be basically losing a lot of proteins from the blood to the urine. And so part of these proteins that we're losing into the urine are immunoglobulins, right? And as you guys know, immunoglobulins are in charge of the immune system. And so because we're losing so many immunoglobulins, we have a decreased immune system, which allows for an increased risk of infections. And so then the second complication is thromboembolic events. So why is this happening? So basically, because we're losing so much volume in the blood vessels, it makes it easier for the blood to pool. And as you guys already know, when blood pools, it basically increases the chance and the risk of developing a thrombi. So then this thrombi can move around the body and become an embolus, which leads us to a third complication, which is renal vein thrombosis. So basically this thrombus will move around the circulation, and it could potentially include the blood going into the kidneys and lead to renal infarction. Hey. Okay guys, and then to finish off this video, nephrotic syndrome is associated with three glomerular lesions. The first one is minimal change disease. The second one is focal segmental glomerulosclerosis. And then the third one is membranous glomerulonephritis, okay? And one last thing, so nephrotic syndrome is also associated with various systemic diseases, such as diabetes mellitus, amyloidosis, and finally SLE, so systemic lupus erythematosus. So anyways guys, I hope you enjoyed this video and it helped you in some kind of way. As always, if it did, make sure you hit the like button down below, go check out my other videos and subscribe. And of course, I hope you're having a chill day, and I'll see you later. Peace out.